SpaceX just posted numbers that would make almost any other company look unstoppable, and yet the stock still dropped hard right after the report came out. Second quarter revenue came in at $7.814 billion, a 92% jump from a year earlier, and a beat across every part of the business. But SpaceX still posted a net loss of $541 million for the quarter, with an operating margin that came in negative, at about 1.8% below break-even. Investors clearly zeroed in on how much the company is spending to keep growing, and shares fell more than 8% at one point in after-hours trading even after the revenue beat. Break the business down, and you can see why the stock reaction was complicated. Starlink, the satellite internet arm the company still calls its connectivity segment, brought in $4.3 billion, up 66% from a year ago, and subscriber numbers doubled to 12 million people. Connectivity was also the only part of SpaceX that actually turned a profit, generating $1.660 billion in operating income on its own.
This is Conference Hype. Stay with us, coverage continues.
The traditional rocket launch business, what SpaceX now calls its space segment, brought in $962 million, up 29% and ahead of the $835 million analysts expected. But here is the twist: rocket launches, the thing SpaceX is most famous for, are now its smallest business line. The fastest-growing piece by far was the company's AI segment, covering Elon Musk's xAI, the X social media platform, and cloud computing services, which more than tripled to $2.560 billion, up 247%. SpaceX still ended the quarter sitting on $100 billion in cash, with a backlog of future business worth $47.5 billion. Here's the part that should matter to anyone tracking healthcare and pharmaceuticals. Those same SpaceX rockets that are supposedly becoming a side business are quietly turning into critical infrastructure for an entirely new way of making medicine. A growing number of drug companies are now sending experiments and manufacturing hardware to orbit, specifically because microgravity changes how molecules crystallize and assemble in ways that are useful back here on Earth. Merck has already run research aboard the International Space Station aimed at improving the formulation of pembrolizumab, the active ingredient in Keytruda, the same cancer drug Merck just told investors is being pushed hard in a new, faster injectable version. Redwire, a space infrastructure company, built an entire subsidiary called SpaceMD around this idea and has already flown 54 small manufacturing units, testing 37 different drug compounds in orbit, working with partners including Eli Lilly and Bristol Myers Squibb. Another company, Varda Space Industries, has gone even further, building an autonomous 300-kilogram manufacturing satellite with its own reentry capsule designed purely to make drug ingredients in space and bring them home. Varda just completed its 6th capsule flight, and it launched on one of SpaceX's transporter rideshare missions, the same rockets that show up in SpaceX's own earnings report as its shrinking launch business. The economics behind all of this sound almost unbelievable until you hear the numbers. Because active pharmaceutical ingredients are so concentrated and valuable, the crystalline material needed to supply 450 million patients with Pfizer's COVID vaccine could physically fit inside 2-gallon-sized milk jugs. That is the kind of value density that makes even expensive rocket rides worth it. Morgan Stanley thinks the entire space economy could top $1 trillion by 2040, and its analysts have specifically flagged medicine as the industry most likely to be disrupted first. So while Wall Street was busy punishing SpaceX's stock over rising costs and a quarterly loss, the company's rockets are already carrying the earliest experiments in what could become an entirely new, orbital chapter of the pharmaceutical industry. That is the story of SpaceX Q2 2026 earnings and its rocket's role in space-based drug manufacturing. Add your perspective in the comments, share this story with a colleague, and subscribe for the next Conference Hype narrative.